Penis health is an important, yet often overlooked aspect of overall well-being. Many men assume that simple hygiene or general health practices are enough. But the truth is, there are specific mistakes that can lead to discomfort, infection, or long-term issues. Let's explore 5 common penis care mistakes that you might be making and learn how to avoid them to ensure optimal health and confidence. First and foremost, one of the most frequent mistakes men make is neglecting proper hygiene. The penis, like any other part of the body, requires regular cleaning to prevent the buildup of bacteria, sweat, and dead skin cells. This is especially true for men who are uncircumcised, as the foreskin can trap moisture and debris. However, there's a delicate balance to maintain. Overwashing or using harsh soaps can strip the sensitive skin of its natural oils, leading to dryness, irritation, and even microtears that increase susceptibility to infections. The key is gentle, regular washing with warm water and a mild, fragrance-free soap. When cleaning, pay attention to the folds of skin, and if uncircumcised, gently retract the foreskin to clean underneath. Never forcefully, as this can cause injury. The second mistake is ignoring signs of irritation or infection. Redness, itching, unusual discharge, or persistent odor should never be dismissed as minor inconveniences. These symptoms can signal a range of issues, from yeast infections to sexually transmitted infections, or even allergic reactions to soaps or latex. Many men feel embarrassed to seek help for genital problems, but early intervention is crucial. If you notice any unusual changes, like lumps, sores, persistent pain, or changes in the color or texture of the skin, it's important to consult a healthcare provider promptly. Remember, your sexual health is an integral part of your overall health, and prompt care can prevent more serious complications down the line. The third common mistake involves unsafe grooming practices. Pubic hair grooming is a personal choice, but it's important to approach it safely. Using dull razors, shaving without lubrication, or employing improper techniques can lead to cuts, nicks, ingrown hairs, and razor burn. These small injuries may seem insignificant, but they can become entry points for bacteria, resulting in infections or painful abscesses. If you choose to shave, always use a clean, sharp razor and a quality shaving cream or gel. Trim hair first to reduce tugging, and shave in the direction of hair growth. Afterwards, rinse with cool water and apply a soothing, alcohol-free moisturizer to reduce irritation. Avoid sharing razors with others, as this can transmit pathogens. The fourth mistake is wearing tight or non-breathable underwear. Fashion and preference often lead men to choose underwear that's snug or made from synthetic materials. However, tight, non-breathable fabrics can trap heat and moisture, creating an ideal environment for fungal and bacterial growth. This can lead to jock itch, yeast infections, and general discomfort. Additionally, prolonged compression may affect blood flow and, over time, could impact fertility or erectile function. To promote genital health, opt for underwear made from natural, breathable materials like cotton. If physical activity makes you sweat, change out of damp underwear promptly. Give yourself time to air out when possible, and avoid wearing tight-fitting pants for extended periods. The fifth and final mistake is neglecting regular self-examination. Many men overlook the importance of monitoring their genital area for changes. Monthly self-exams help you become familiar with the normal look and feel of your penis, scrotum, and surrounding skin, making it easier to spot abnormalities early. Look for lumps, bumps, sores, color changes, or any unusual discharge. Examine the skin for signs of inflammation and gently feel for any swelling or tenderness. Early detection is key for conditions like testicular cancer, which is most common in younger men, but highly treatable when caught early. Incorporate self-examination into your monthly health routine, and don't hesitate to discuss any findings with your doctor. Beyond these 5 common mistakes, there are several other factors that can impact penis health. Sexual practices play a significant role. Using protection such as condoms not only prevents sexually transmitted infections, but also reduces the risk of irritation from bodily fluids. If you're sexually active with multiple partners, regular STI screenings are vital. Lubrication is also important. Using adequate, body-safe lube can prevent friction burns and microtears during intercourse or masturbation. Avoid petroleum-based products, which can degrade latex condoms and increase infection risk. Instead, choose water-based or silicone-based lubricants. Diet and lifestyle choices affect genital health too. A balanced diet rich in vitamins, minerals, and antioxidants supports circulation and tissue health. Excessive alcohol, smoking, or recreational drugs can impair blood flow and nerve function in the pelvis, contributing to erectile dysfunction and other problems. Staying hydrated, maintaining a healthy weight, and exercising regularly all promote optimal blood flow and hormonal balance. Mental and emotional health are equally important. Stress, anxiety, or depression can influence libido and sexual function. Open communication with partners, regular relaxation, and seeking mental health support when needed all contribute to a healthy sexual life. Additionally, misconceptions about penis size or appearance can lead to unnecessary anxiety. Remember that health and function matter far more than aesthetics. Let's delve deeper into each of these areas to clarify what best practices look like and dispel common myths. Regarding hygiene, it's a myth that the penis needs to be scrubbed aggressively or exposed to strong antibacterial soaps. These practices can disrupt the natural microbiome, a balance of beneficial bacteria that protect against infection. For circumcised men, cleaning is simpler, but it's still important to wash around the head and shaft, making sure to rinse thoroughly. For uncircumcised men, gentle retraction and cleaning under the foreskin is essential. After washing, pat dry with a clean towel, since moisture trapped in folds can promote fungal growth. Another hygiene-related concern is the use of scented products. Fragrance soaps, lotions, or sprays may seem appealing, but they often contain chemicals that cause allergic reactions or disrupt the skin's protective barrier. If you want to use a moisturizer, opt for a hypoallergenic, unscented product designed for sensitive skin. Avoid talcum powder, which has been linked to skin irritation and, in some studies, more serious health risks. On the topic of irritation and infection, it's important not to self-diagnose or rely on internet remedies. While some minor irritations can be managed at home, such as using an over-the-counter antifungal cream for mild jock itch, persistent or worsening symptoms require professional evaluation. Sexually transmitted infections can present subtly. For example, chlamydia or gonorrhea may cause only mild discomfort or discharge, but left untreated, they can lead to serious complications. Regular sexual health checkups are a proactive way to protect yourself and your partners. Grooming, as mentioned, requires care. Waxing, depilatory creams, or electric trimmers each have their own risks. Waxing can cause trauma to sensitive skin, and depilatory creams often contain harsh chemicals that may burn or irritate the genitals. If you choose to groom, patch test any product on your forearm first and follow the manufacturer's instructions closely. After grooming, avoid tight clothing for a day or two to allow the skin to recover and prevent ingrown hairs. The choice of underwear and clothing often comes down to lifestyle and activity level. If you're active or prone to sweating, moisture-wicking fabrics are a good choice, but ensure they're breathable. Cotton remains the gold standard for everyday comfort and health. Consider rotating different styles, briefs, boxers, boxer briefs, to see what works best for your body. If you experience persistent irritation or rashes, try switching detergents or fabric softeners, as these can sometimes cause allergic reactions. Self-examination is a skill that can be learned easily. Begin by standing in front of a mirror in a well-lit room. Examine the skin for any changes in color, texture, or the appearance of sores, rashes, or blisters. Gently feel along the shaft and testicles for lumps or swelling. Note any pain or tenderness and check for discharge by gently pressing at the tip of the penis. If you're unsure what's normal, ask your healthcare provider for guidance. Establishing a baseline for your own anatomy will make it easier to spot changes if they occur. Additionally, maintaining good sexual practices is vital. Use condoms consistently and correctly to lower the risk of STIs, even during oral sex. If you're allergic to latex, opt for polyurethane or polyisoprene condoms. Lubrication is key for comfort and safety. Insufficient lubrication can cause friction burns, especially during prolonged activity. If you or your partner experience discomfort, take a break and reapply lube as needed. It's important to address misconceptions about penis health and function. Many men worry about size, shape, or curvature, fearing it will affect their sexual satisfaction or their partner's experience. In reality, the vast majority of penises fall within a normal range, and function far outweighs appearance in terms of health. Peyronie's disease, a condition causing curvature due to scar tissue, is rare, but if you notice significant changes in shape or painful erections, seek medical advice. Performance anxiety is another common issue. Concerns about stamina, erection quality, or ejaculation timing can lead to stress and avoidance of intimacy. If you experience ongoing difficulties, consider talking to a healthcare provider. There may be underlying physical or psychological causes that can be addressed with counseling, lifestyle changes, or medical treatment. In terms of diet and lifestyle, focus on heart-healthy habits. The penis relies on strong blood flow. What's good for your heart is generally good for your sexual health. Eat plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Foods rich in antioxidants, like berries, nuts, and leafy greens, support tissue health. Regular exercise improves circulation, hormone balance, and mental well-being. Aim for at least 30 minutes of moderate activity most days of the week. Smoking and excessive alcohol consumption are two major risk factors for erectile dysfunction and other genital problems. Smoking damages blood vessels, reducing blood flow to the penis and impairing erectile function. Alcohol can dull nerve responses and lower testosterone. If you smoke or drink heavily, consider reducing or quitting. Your body will thank you. Hydration is often overlooked, but crucial. Dehydration can cause skin dryness, reduce natural lubrication, and impact erectile function. Aim for at least 8 glasses of water per day, more if you're active or live in a hot climate. Mental health should not be underestimated. Chronic stress increases levels of the hormone cortisol, which can suppress testosterone and reduce libido. Anxiety and depression can impact sexual desire and satisfaction. Practice stress-reducing techniques like meditation, deep breathing, or yoga. If you're struggling emotionally, reach out to a professional. Mental health is an essential part of overall wellness. Let's talk about the importance of communication in relationships. Open dialogue about sexual preferences, boundaries, and health concerns builds trust and reduces anxiety. If you're experiencing discomfort, pain, or changes in sexual function, share your concerns with your partner. Supportive relationships make it easier to seek help and maintain healthy habits. It's also vital to protect against injuries and trauma. Athletic activities, cycling, or contact sports can create risks for genital injuries. Wear appropriate protective gear, such as athletic cups, and avoid prolonged pressure or friction. If you do experience trauma, such as a direct blow, twisting injury, or unusual pain, seek medical attention promptly. For those who use medications or supplements, be aware of potential side effects. Some pharmaceuticals, including antidepressants, blood pressure medications, or hormone therapies, can impact sexual function. Over-the-counter supplements marketed for sexual enhancement are often unregulated and may contain harmful ingredients. Always consult with a healthcare provider before starting new medications or supplements. Age-related changes are natural, but proactive care can help maintain sexual health throughout life. Testosterone levels gradually decline with age, which may affect libido, erection quality, or energy. Regular physical activity, healthy eating, and good sleep support hormonal balance. If you notice significant changes, talk to your doctor. Sometimes hormone therapy or other treatments may be appropriate. Finally, let's address common myths and misconceptions. Some believe that frequent masturbation will cause harm or reduce sexual ability. In reality, masturbation is a normal and healthy activity for most men. It can help relieve stress, improve mood, and even support prostate health. However, if it interferes with daily life or relationships, it may be worth discussing with a professional. Another myth is that only sexually active men need to worry about penis health. In truth, hygiene, self-examination, and good lifestyle habits benefit everyone, regardless of sexual activity. Problems can arise from infections, trauma, or underlying health conditions unrelated to sex. To summarize, penis care involves more than just hygiene. It's about adopting safe grooming habits, wearing comfortable clothing, practicing regular self-exams, and making healthy lifestyle choices. Avoid harsh chemicals and aggressive cleaning. Stay alert for signs of irritation or infection, and seek prompt medical attention when needed. Communicate openly with partners, protect yourself during sexual activity, and nurture your mental and emotional well-being. By avoiding these 5 common mistakes, neglecting hygiene, ignoring signs of irritation, unsafe grooming, wearing tight underwear, and skipping self-exams, you can protect your health, boost your confidence, and enjoy a more satisfying, comfortable life. Penis health is a key component of overall wellness, and small changes in daily habits can make a lasting difference. If you're unsure about any aspect of your genital health, don't hesitate to reach out to a healthcare provider. Early intervention is always best, and there's no shame in seeking support or advice. Remember, caring for your body is an act of self-respect and a foundation for lifelong well-being. Make penis care a routine part of your health regimen, and you'll be on the path to better health, greater comfort, and peace of mind.